Alright guys, let's get busy talking about our anti-androgens. If you have not watched our video on androgen modulators, go ahead and take a look at that first because we walk through this diagram of androgens and how they are produced and where they exert their effects throughout the body, and so that will be really helpful to orient you before we talk about our anti-androgens. So continuing our conversation, let's talk about our anti-androgens, which are largely going to have androgenergic effects in terms of anti-androgenergic effects. So they're going to be blocking androgens or preventing synthesis of androgens. And so let's start out by talking about flutamide and bicalutamide. Don't worry, we will return to finasteride, but I want to save it for the end because it's kind of special. So in terms of flutamide and bicalutamide, these are non-steroidal competitive inhibitors at androgen receptors, and these are going to decrease the amount of steroid binding at our androgen receptors, and these are going to be non-steroidal agents. So if we take a look here is our flutamide, and essentially it is not a steroid, it is just an inhibitor that is a non-steroid that is acting directly here at our androgen receptor. And when it acts at this androgen receptor, it's preventing other androgens from binding here and exerting their effects. We can use this for prostate cancer because we know that prostate cancer is very sensitive to androgens, so if we can block those, we can improve the side effect profile and the tumor growth in these patients with prostate cancer. In terms of adverse effects, we'll be looking for gynecomastia and sexual dysfunction. Let's move on now to talking about abiraterone, and abiraterone is going to be inhibiting two of the enzymes in the steroid hormone synthesis pathway that are ultimately going to become androgens. So they're going to inhibit 17-alpha hydroxylase as well as 17-20 lyase. And when we inhibit these two enzymes, we're going to have decreased production of androgens because we are interrupting the steroid hormone synthesis pathway. So ultimately we're going to have decreased steroid production via inhibition of both of these enzymes. Let's take a look in our diagram where this acts. So we have abiraterone here, and it's inhibiting 17-alpha hydroxylase, and I'm going to draw an additional line that I had absent because I wanted our diagram to look cute, but we're also going to be inhibiting 17-20 lyase over here, and so this is going to cause decreased production of androgens, and that is the mechanism of action of this drug. And if we look at its indication, it's going to be for prostate cancer, and then this can cause hypertension and hypokalemia as well as adrenal insufficiency. And let's take a look at why this is the case. If we come back over here to our master diagram, if we're inhibiting 17-alpha hydroxylase and 17-20 lyase, we are essentially shunting everything down here towards mineralocorticoids. So we're getting a lot more aldosterone, which is going to increase blood pressure. It's going to lower our potassium. And then by inhibiting our 17-alpha hydroxylase here, we're going to have less progression down here towards glucocorticoids, which can cause adrenal insufficiency. And so that's kind of an explanation of why these side effects occur when we're using this drug. Let's move on to our next drug now. We're going to talk about ketoconazole. And ketoconazole is going to be a 17-alpha hydroxylase and 17-20 lyase inhibitor. This is going to decrease steroid production as well. And I also want to mention that ketoconazole also is going to inhibit cholesterol desmolase. However, that's going to inhibit all steroid production, whereas I wanted to focus on the fact that it inhibits 17-alpha hydroxylase and 17-20 lyase because this is going to be more specific towards its anti-androgenergic effects. But ketoconazole has a lot of influence throughout the entire steroid hormone synthesis pathway, and I just wanted to highlight that for you guys. In terms of what we use ketoconazole for, we can use it for treat prostate cancer or polycystic ovarian syndrome, and then in terms of side effects, we can see gynecomastia and amenorrhea. Lastly, we're going to talk about spironolactone, and spironolactone is really interesting because it has two different mechanisms of action. It's going to first act as an androgen receptor inhibitor, and that's going to be out in the periphery, and then within the adrenal cortex steroid synthesis pathway, it's going to inhibit 17-alpha hydroxylase and 17-20 lyase, making decreased steroid production. So if we take a look over here, we're going to highlight our spironolactone in pink, and you can see that it exists in two different areas. Over here, it's going to have direct inhibition at the androgen receptor, whereas here it's going to inhibit 17-20 lyase and then also 17-alpha hydroxylase, and that way we're going to get decreased steroid synthesis here. And so this is kind of a two-hit punch in terms of the mechanism action of spironolactone. And some indications for spironolactone are going to be PCOS, and then side effects are going to be gynecomastia and amenorrhea. So let's move on now finally to talk about finasteride, which I told you we were saving for the end, and I'm going to highlight highlight finasteride in two colors. I'm going to make it half red and I'm going to make it half green. And this is because I think of finasteride as both an agonist and antagonist depending on how you look at it. And this is because its mechanism of action is 5-alpha reductase inhibition, which is going to lead to decreased conversion of testosterone to DHT, which happen to both be androgens. So in all of our other drugs, we were either talking about creating less androgens, which was largely happening in this area here, or we were preventing conversion into estrogens, which was happening here, or we were acting in the peripheral receptors here, either decreasing or increasing the effects of androgens. However, finasteride is unique because it sits in here within the universe of all the androgens. So I highlighted it here in green and red because essentially we're staying within androgen territory when talking about finasteride and 5-alpha reductase. We're simply increasing the amounts of one androgen at the expense of decreasing the amounts of a different androgen. And so this is kind of strange because we are increasing the agonism by testosterone but decreasing the amounts of DHT. So this is kind of a mixed picture. I'm not sure to consider this like a direct androgen antagonist or agonist because it's kind of in the middle. So I would rather you guys understand what finasteride is and what it does rather than lump it as like pro-androgen or anti-androgen. So going back here to our table, we're talking about the mechanism of action. It's all about 5-alpha reductase inhibition. That's really high yield, that you know that finasteride inhibits this enzyme. They love to ask about it. We can use this for male pattern hair loss and also benign prostate hyperplasia. And this is because these areas of pathology are really sensitive to levels of DHT, dihydrotestosterone. And so if we can reduce this and make this all into testosterone, it's going to be a lot more beneficial for patients suffering from these two disease processes. In terms of adverse effects, it's going to be very similar to our other drugs, gynecomastia and sexual dysfunction. So the important things when it comes to talking about androgen agonism and antagonism is understanding this diagram. If you can understand the diagram and the whole flow from steroid precursors to androgens to estrogens, and then understanding where androgens execute their effects throughout the body, then you can go ahead and start applying our different pharmacologic options into this pathway and seeing how they are going to change physiology and pathophysiology in terms of disease. So rather than memorize what each of these drugs does, I would understand where they fit into this overarching schema, and this will allow you to get a lot more questions right because you won't have to memorize anything. It will just be about understanding and applying your knowledge. I really hope you guys enjoyed this video. Can't wait to see you guys in the next one. Bye!